that is going to affect a lot of people out there trying to get Social Security, Medicare, Medicaid, and all the rest of it. This is something that nobody's really talking about. I haven't seen anybody talk about this. The stimulus check. Okay, the tariff stimulus check. I give it about a 10%. It's got to go through the House, got to go through the Senate. It looks like the Supreme Court might kick that back and they have to return that money. So about a 10%. But there's a 100% chance that that stimulus check, the talk of a stimulus check, is going to affect a lot of people out there. And that's what we have Sarah here today. If you're new to my channel, this is what we do on a daily basis. We help people out throughout the country navigate Social Security, Medicare, Medicaid, SNAP, ACA, and all the rest of it, and answer your questions. My name is Ed Weir. I ran the third business Social Security office in the country, and we've got Sarah here from Chapter. And what we do here is help you navigate the bureaucracy. And the problem with stimulus talk is that what happens is, as soon as they start talking about that, then people start calling Social Security and said, where's my check? Where's my money? Where's my money? I just got my direct deposit and I didn't get the $2,000 that the president said I was going to get. And the problem with that is that it slows everything down. There's 10,000 people every day turning 65 years old. A lot of people getting laid off, and they need their Medicare. And they try to call Social Security, get signed up for Part A and Part B, or survivor's benefits or disability benefits. And the Social Security employees who are already way, way low, the worst they've been since 1935s in terms of staffing, they're answering calls all day about the stimulus check. So let's not call about the stimulus check. I always say, for the last few decades, anytime they talk about stimulus check, if you know you get it when it's in your bank account. Before that, then don't spend it. I know it's in the Constitution that we as Americans can spend money before we get it, but let's not this time. All right, so the important thing is, a lot of people are not going to get the help they need out there with all things Social Security, Medicare, and Medicaid. And so that's why we put our team together here. Includes our illustrious Sarah from Chapter, and her team do some awesome stuff. So thank you for joining us, Sarah. How you doing today?
I'm doing well. It's great to be here. Glad to be back.
I'm sure it's a nice little break from the craziness, right?
Yeah, it is.
All right. So for those people that don't know it, that we're in the annual enrollment period, which starts from October 15th and goes to December 7th. And Sarah and her team probably got 3 hours of sleep in the last few weeks because there's a lot of people out there that are reaching out to Chapter. And I don't want to discount, we've had Ari here a few times, and I don't want to discount him and his team. Those are the people that help help people find the best Medicare plan for them for 2026. They do an awesome job, but once they find the best Medicare plan for you, for everybody, then the important thing, I would argue, don't tell Ari I said this, but the important thing is Sarah and her team. What kind of stuff do you help people the other 365 days of the year?
Goodness. I mean, all kinds of things, ranging anywhere from issues that you have with billing for like your premiums on your plan, like what you pay monthly, or let's say something was billed incorrectly to the insurance company by your doctor. We help out with all of that. We just make sure that we're able to help you find like dentists or vision providers or regular doctors, or maybe a heart doctor or a lung doctor. We help you locate those in your area. We help you set up accounts with your insurance companies so that you're able to access your plan information online. Gosh, there's so much that we do. It's hard to name all the things.
Perfect.
Yeah.
All right. So let's get into that. And if you got any questions, this is a live Q&A. So if anybody has any questions on any of all that, the Social Security questions, I normally answer Social Security questions, help people, get disability benefits, survivor benefits, retirement, and all that kind of stuff. But since our focus today is on Medicare, we'll try to stick to Medicare unless we see something super, super important that I need to answer. But one thing, one of our regulars, Tammy, she also goes by Ann, who actually we found several $100s more a month for her. So, and she has a question. She's having a problem with telehealth, and I understand that telehealth was really, really expanded during the pandemic, but now they're pulling that back generally. but are there exceptions for people like Tammy that really need that help?
There are for telehealth services. So on Medicare's website, it does say that like people who are ESRD or like they have end stage renal disease, kidney issues, mental health issues. These are just some examples of what is covered for telehealth, or if you're in a rural area and it's hard for you to access healthcare.
Okay, so they are making exceptions, just like I always tell people on Social Security, there's over 20,000 pages of policy, and there's exceptions, the exceptions, the exceptions on pretty much everything. So
Mhm.
they are making some type of exceptions. So how would she get it if she's a member of chapter? If y'all help sign her up, then she's a member of chapter, and then she just calls you, and y'all fight for her telehealth, right?
Yes, yeah. So some Medicare Advantage plans will offer that as an additional benefit. Like there aren't the same restrictions as there are if you have like original Medicare for that. But yeah, we are able to assist and find telehealth doctors as well that accept the plan or accept Medicare.
Okay, perfect, perfect. All right, but if she doesn't, then what do you recommend if she can't get your help? What do you recommend she do? Just reach out to whatever Medicare Advantage plan and try to make that exception.
We like to reduce contact with insurance companies, so like we're going to do what we can to find to
Right.
find what she needs. Yeah.
Oh, okay. So through
Mhm.
the actual doctors themselves rather than dealing with the insurance companies.
That's correct.
Okay. Okay.
Yeah.
Someone says, Sonia, so far I've received 3 calls that I have Medicare money left over for 2025 that I can get reimbursed. I know I didn't go to the dentist in 2025. Could that be it, or is this a scam? This is the first time I think I've heard this year of, yeah, that in previous years that was kind of a scammy type thing. But yeah, have you heard anything on this? Reimburse Medicare money?
Yeah, so some insurance companies like Devoted, they have their dental benefits set up as a reimbursement. So they may be
Oh,
contacting for that.
oh, okay. So
Yeah.
Sonia, I think what Devoted is in big in California and some other, but they're not nationwide, right? That's still
Right,
kind
they're
of localish.
available. Yeah, there are I mean I can't count how many states that they're available in. They are available in a lot of states, a lot more than in previous years, but
Oh,
mhm.
okay. They're expanding. Oh, okay.
Yes.
So they have so for instance, they $2,000 a year or something like that. And if you don't use it, they reimburse a certain amount of that.
No, it's just if you happen to use the benefit, you can submit for a reimbursement for it. Like, there's no network restrictions on dentists, you can see whatever dentist you wanna see. You would just pay upfront and then submit the reimbursement. We
Oh,
help with
okay.
that too, like,
Oh,
with our
okay.
members that have that. Mhm.
Yeah, this one it looks like it's leftover money um, that didn't use the dental, and then it sounds like she's talking about, I've got $2,000 of dental, I didn't use it, and now they're calling me and said I can get that money back. I don't think I've heard that one.
That part is a little scammy.
Yeah.
That's some misrepresentation for sure.
Yeah. Yeah. I think, yeah, I've heard of these in previous years. This is the first time I've heard it this year. That, yeah, in any, it's kind of like, the lottery type things and, oh, you've got, you're part of this class action suit. And so if you give us $100 or $500, we'll help you get that $10,000 reimbursement from whatever. So yeah, Sonia, I would be very, very, very careful on that one. Don't call the number on anything like this. Don't call the number they give you. Don't click on the website they give you. Same thing with Social Security. People says, "Oh, you've got, you get an email that looks like it's from Social Security. It's got, ssa.gov or slash, they kind of manipulate it a little bit." And they say, go ahead and log into your account because we've got a very, very important critical thing that might stop your benefits. And so you click on that, you think you're going to your My Social Security and you're going someplace else. So if you ever get anything like this, including this, say, oh, okay, that's interesting. Delete and then
Mhm.
go to ssa.gov or go to whatever insurance company you have and say, hey, what's the deal with this? But this is important though. This is one of the things I did yesterday that people need to do immediately is if they have dental benefits, because those dental benefits don't carry over till next year, right?
That's right. Yeah. The benefits will reset at the beginning of the year. So,
What type of, you got to use it by December 31st.
right. If you don't use it, you lose it.
Yep. All right. So go out there and schedule an appointment. As I always say, if you've got $4,000 of dental work and you've only got $2,000 in your account, do the bottom half by December 31st, do the top half after January 1st. Make sure you don't want to be stuck out there in the wind. Make sure your new plan that you signed up for does have dental, the $2,000 to cover you for the other part. Do you see any trends on dentists, people dropping out, the Medicare Advantage plans? What type of issues do you see with dental benefits in these plans?
I wouldn't say an issue. I would say more of an inconvenience that I'm seeing. So kind of like the trend we saw last year with plans, the benefits are decreasing for dental. A lot of plans are getting rid of the comprehensive aspect to it. So these are things like dentures or extractions. That sort of coverage is not as available as it once was, and it's just basic coverage. So like your regular periodontal cleanings are being covered. Plans that do have like a higher comprehensive benefit allowance typically have higher copays. So there's more than likely going to be a trade-off going into the new year for benefits.
Yeah, I think there was a small trend on implants, that some companies were covering some level of implants, and those things are crazy expensive to begin with. So if they're just going back to basic cleanings now, a lot of these companies are definitely not going to cover implants, right?
Most of them are not covering implants. That's correct.
All right. What about prior authorizations? So that's the big thing on Medicare Advantage. For Medicare Advantage, you've got two issues that you have to deal with. One is the networks, which Sarah already mentioned, that she helps people, the members. If you lose your doctor, your specialist, or whatever the case may be, and you're looking for in-network, you can't find one, then you can reach out to Chapter and they find. I guess last time you mentioned you were even scheduling appointments for people, right?
Mm-hmm. That's correct.
Okay, awesome. So that's the issue with Medicare Advantage, is those networks. And those networks, do you see them kind of declining a little bit? Fewer and fewer doctors taking Medicare Advantage?
It just depends on where you live. I was actually looking up a health system for a member the other day and saw that like they're pretty much not accepting any Medicare Advantage plans for primary care, which is a huge disadvantage to the population that live in that area.
Yeah, a lot of people call it Medicare Advantage, Medicare Disadvantage, specifically because of that, because of, the limited networks and kind of the nickel and the dime and all the rest. Nona says, "Hi, Sarah, great to have you here." So Morrissey, and you see how they typed out Morrissey with like 15 E's.
Yeah.
Must be
Somebody actually quoted you on the disadvantage the other day. One of our members
Oh,
did.
okay.
I thought that was a little
Okay.
funny.
Yeah. Oh, I use some words sometimes and I forget I use them, like the golden ticket that people get when they got denied their PPO plan, when their PPO plans have been canceled. They get the letter and says, "Okay, well, thanks. It's nice knowing you, but we don't want to give you this Medicare Advantage. We're pulling out of the entire state or the area." And I always called that the golden ticket. And then someone said, "Hey, I just got a golden ticket." I'm like, "What's that?" And I'm like, "Oh yeah, that's right. I talked about that yesterday."
Yeah, don't throw those away.
Oh, yes. Don't throw those away. Absolutely. So, so the other part of Medicare Advantage is the prior authorizations. You see any type of trends on prior authorizations? What are people giving you a hard time about?
No, actually, this is something that we've seen a lot of improvements on, and some of the insurance companies are taking like charge in that next year where they're not requiring as many prior authorizations for certain services. So I'd
Oh,
say
okay.
that's going in a more positive direction with some of these insurance companies.
Yeah, the government was going to come down and regulate, and I think some of the insurance companies, rather than that, they kind of promised they will do better. I think that was the deal, and so as of right now, maybe depending on the area, right?
Dependent on the carrier. Like, Humana has made some really big changes with prior authorizations for the better. I believe they recently partnered with MyChart, so they're able to have more of an open line of communication with providers that are contracted with Humana.
Okay. Let's see. Someone says, let's see, I called Chapter and kept same insurance, but better coverage. Dental, medical, eye care, and Advantage card added $125 per month and covers all co-pays. They were okay, cool. Yeah, a lot of people don't realize that is they say, well, I like the company I'm with. Okay, fine, keep that company. But there are several plans, each, I think, pretty much all throughout the country. Generally correct, except for some places out in the middle of the desert that have, one one company, one plan. But most other parts of the country, you have those big players that have multiple plans in a particular area. So if you really, really, I mean, for whatever reason, you really love the company, fine, keep the company, but switch to another plan if that company has a plan that is better for you. They come out with quite often new plans every single year. And yeah, a lot of people don't realize that.
Yeah.
All right. We see any other questions here on authorizations, network, fighting doctors? So you see some doctors kind of giving up on Medicare Advantage plans. I know, was it the Mayo Clinic already stopped accepting Medicare Advantage, right?
Mm-hmm. That's right.
Yeah. Yeah, so it's like I was going to mention that the Secretary of Treasury Secretary already kind of backing out of the stimulus thing. So please, when we get the check, when you get it in your bank account, then you know you got it. But please don't call Social Security. It ruins it for everybody else. We've got in terms of signing up for Medicare, when it's automatic. If you're 65 years old and you're already receiving benefits, you don't have to do anything. About 100 days or four before you turn 65, Medicare will send you your card automatically, Part A, Part B. Are you seeing people having difficulties declining Part B once they're signed up automatically at 65? Because I think when you get the packet in the mail with your A and B card, you can refuse Part B if you have health insurance from current work, yours or your spouse's, 21 employees. And I haven't noticed any issues in that regard, that they don't have any issues denying Part B. Do you see anything?
No, I mean, the only instances I've seen that is like they're outside of an enrollment period. It's like they're out of their Part B SEP or special enrollment period, or they're not in their initial enrollment period anymore.
Okay. Yeah, that is probably the top 2 or 3 most difficult things in Medicare are the enrollment periods. The special enrollment period, the initial enrollment period, the trial rights. You can try Medicare Advantage for a while and then switch back and forth. And yeah, those are difficult. I don't want to skip this question. How can I get a drug plan with Social Security? How does someone get a drug plan with Social Security?
It would be through Medicare or us. Like you can call the number that you see above my head, and an advisor will be able to talk to you about a drug plan.
A lot of those drug plans, have definitely changed quite a bit over the last few years. There's the smoothing thing. Do you want to talk about smoothing this year? I think this year it's automatic for that $2,100, right?
Mm-hmm.
So you want to talk about how that process works?
Yeah, we can talk about that.
Okay, go for it.
I guess I can start out by really just explaining the drug phases. There's 3 phases of drug coverage with Medicare. So the initial phase is going to be that deductible phase, which for 2026 is $615 for Part D drugs. So most of the time, like your brand name drugs are going to be what goes towards that deductible. But if you take any generics, more than likely, you're not going to have to worry about that deductible. After you've met the deductible phase, it goes into what we call the initial phase, which just means these are the costs that are set by the plan. So like, let's say A tier 3, like brand name drug, is $47 after the deductible. Once you've met that $615, that cost is going to drop down to $47 for a 30-day supply of a brand name drug. You would keep paying that until you hit the catastrophic phase, which means your out-of-pocket costs and the plan's out-of-pocket costs for your drugs hits $2,100. Once $2,100 is hit, your drug costs will drop down to zero for the remainder of the year. So that's been a really, really positive change for Medicare recipients.
Good deal. Good deal. Yeah, we haven't got the other officials' numbers. I checked before I came on. I didn't see that they notified us of Part B and all the other deductibles and stuff for 2026. Hopefully that should come by pretty quickly here. Sue says, can my Advantage plan change copays during the year without telling me? This is for telehealth with the PCP.
No, they cannot change copays. They set all of that prior to the annual enrollment period. They finalize everything by September of every year. So they're not allowed to make any sort of copay changes in the middle of the year.
Okay, perfect. But they can change doctors. That's one thing a lot of people don't realize. And they're like, okay, the only reason I took this particular plan, it wasn't the exact plan I wanted, didn't have the dental, it was a little bit more for, for a hospital or something like that. But it's the only plan in my area that had the doctor I got to go see. But those doctors can drop the plans anytime, right?
Yes, doctors can end their contracts any time of the year with insurance companies.
But that is not a special enrollment period opportunity to say, well, I lost my doctor and therefore I want to switch plans. The doctor can drop it, but people can't, right?
That's right. There have been instances, though, where bigger healthcare systems, if they end things with a carrier in the middle of the year, Medicare might make an exception for that.
Oh, okay. Okay. Good deal. Good deal. All right. What about, so we're getting on drugs there, tiering. I've got on my website, mygovexpert.com, where I talk about tiering, that you can request / AKA fight the bureaucracy and requests. If you have a particular drug that costs a lot because it's tier 3 or tier 4 or something like that, you can appeal that and request, a lot of people don't know this, and request them to downgrade, which is a good thing, downgrade it to a lower tier to save money, right?
That's correct.
Any suggestions on that? Have y'all been doing any of those recently? And what type of success rate are you looking at?
I would say they're one of our less common types of exceptions that we help our members with. But we have been successful with that, as long as the doctor is super cooperative with what is needed for documentation, then we typically will not have any issues. Like if there's documentation in their medical history that says that they can't take the tier 2 because maybe they have an allergic reaction to the generic drug and they have to take the brand name drug, but finances aren't really in place to be able to pay for that. That's usually where we see that approval.
Okay. All right. So it's always, kind of work with the doctors and everything and document that, I just don't want to use this brand because I want to support this company, whatever brand, it just works for me because of my issue, right?
Right.
Okay. I called Chapter and spoke to Justin earlier. Great guy. He sends his regards. Okay. Hey, Justin. I don't know if you're watching, probably not watching, probably on the phone, but
my teammates are trolling me.
All right. So this is a lot crazier than last year. Last year, I think, about after the first week of November, y'all slowed down a little bit. But you're not slowing down, are you?
Oh, no, we have lots of members that we need to touch base with about their coverage for next year. We have a lot of folks losing their plan and they need that golden ticket, to get into a Medigap plan.
Yeah. I as soon as I heard that close to 1 million, one of the major health insurance said they're going to drop 600,000 and the other one followed suit a few days later and said, I think it was close to 300. So we're talking about probably about 1 million people are losing their Medicare Advantage, predominantly the PPOs. So because it just cost the insurance company, they're trying to save money. So I knew it was going to be crazy, but we still have time. So I've got some people that sent me an email. So yeah, if you have a hard time getting through and you've tried, try one more time. And if they don't get back, if chapter doesn't get back with you within 24, 48 hours, send me an email. Someone sent me an email and said, Ari hasn't called back. Send me an email again, but you have to make sure you include your phone number. So my email is ed@mygovexpert.com, because chapter does things right. So if I send them an email to say, hey, contact this person, they can't do it until they confirm that you contacted them first. And the way they do that is by the phone number. So if you contacted them, called them, and we're not able to get through, they have a record that you did call. So they can call you back. They do these things right. So that's one of the reasons I chose y'all chapter, is because you do it right. Not like everybody else. They, call you 40 times a day and you didn't give them permission, which they shouldn't be doing, these other companies out there.
Right.
But if you're having an issue getting through, we still got time. Give it one more shot, give them a call. And if they don't get back to you in 24, 48 hours, then yes, please, please, please email me, ed@mygovexpert.com. And I've come up with a new graphic. Let me show you this here. So you're not alone. Here's what we're doing over the last year or so. This is what we've come together, because it's going to be far more difficult for people to get help with Social Security, Medicare, Medicaid, and all the rest of it. So here's what we've come up with our community over the last year or so. I do my lives pretty much every day. I put the daily is spelled wrong there anyway. To correct that, it's a brand new graphic. This is live. So the daily, until my wife tells me I have to take off, I do it every day. So I help people with Social Security, retirement, survivor benefits, spouse benefits, disability benefits, signing up for Medicare Part A and Part B, to get Part Medicare Advantage, Medicare Supplements, Part D. Then that's why we brought together Chapter and Ari, which I'm not going to discount. That's an important thing to make sure you get the best plan. But the reason people are calling Chapter is because of Sarah and her team, because they need help throughout the year, kind of navigating that bureaucracy of Medicare, their Medicare plan. So year-round help from the Chapters team. And then we've got one-on-one help. I'm putting together a team of retired Social Security employees to help people out. That's the only thing we are charging for, because these are one-on-one. So you go onto my website, mygovexpert.com, and you can click on there, and they're helping people, navigate retirement, survivor benefits, disability. And the most important part of everything is the new website, 24help.org, which is discussion groups on all of those categories. So if you're a survivor and you're looking for survivor benefits, then ask questions there. Disability, CDRs, Medicare, Medicaid, SNAP. So we put together a bunch of discussion groups, a brand new website. So this is y'all's website to help each other out, kind of crowd support all your neighbors. So those are the 5 things that we've got to help people out there navigate and get all the benefits, because unfortunately, the bureaucracy across the board is, not that helpful nowadays.
There is a question I want to touch base on that Jude Sheldon asked. The question is, my roomie wants me to enter a 2-year trial for a new biologic. Will UHC generally allow that? Which I think is a great question. I don't think a lot of people touch base on clinical trials and how it's covered with Medicare. It really just depends on your coverage, but Medicare does have basic coverage for that. So it just depends on what you're getting done, and then Medicare typically covers the visits, so there shouldn't be any issues with your visits to your doctor for it. But I do suggest that you work closely with your doctor on what's covered with Medicare and what's not.
Perfect. Homestead Hippie, who is one of our heroes here, takes care of 3, 4, 5, 6, 15 grandchildren or something. So what's up, Homestead? I can't find a dentist. He is awesome. he or she. I can't find a dentist and network that can make a new partial plate for me. So any suggestions there?
Yeah, I mean, our advocate team can search like the network available to your plan to see if we can find, I believe it's a prosthodontist. Like those are the specialty dentists that can help build partials for you.
Perfect. Let's see. Bonnie, I have a dental on my plan, but it really only covers cleanings and checkups. I'm going to call around and get a standalone dental plan. This way I will have both. What do y'all recommend on standalone dental plans? Y'all don't help with those, right?
We don't help enroll into them just because we specialize in Medicare, but we do have some information we send to our members. So if you want to email us, you can email us at member-support@askchapter.org. We can send you that list of companies that we feel good about for standalone dental.
Perfect. I always recommend people, yeah, I'm not big on dental. It's, when you need it, you get it, and it doesn't cover anything for like 2 or 3 years anyway, right? You got to pay a whole bunch of premiums
Yeah,
for it to cover you later.
it depends on the company. Some companies don't even have waiting periods, which is really nice, but the coverage increases like the longer that you're on the plan.
All right. So I always recommend just check with your dentist and say, the dentist you know and trust, just go there and say, hey, do I even need dental insurance? And they say, oh yeah, no. You just need cleanings. Just go ahead and pay for cleanings every 6 months or whatever. And that's it. But if they say, oh yeah, in a few years, you're going to need a lot of work. So you should get a dental plan. And this is the one I use. So that's usually the best way to do it. So my dental covers $5,888 a year in dental. Wow, that's very specific. What's up, Bella? Yeah. What is the Platinum Dental Rider about? You know anything about those?
I do. That is specific to United Healthcare. So kind of like what I was talking about earlier, plans that are reducing their dental benefit, they're adding on like a monthly rider that you can pay. I believe it's like $54 or $58 a month or something like that, but it allows you comprehensive dental access.
Yeah. So those are in Medicare Advantage plans?
Yes.
Okay. Yeah, I see that for that same company and other companies, possibly when you sign up for a Medicare supplement plan, Medicare supplement plans don't have dental, vision, hearing, prescription drugs. You have to sign up for those separately. But some of those, because there are these giant health insurance companies, even though it's a Medicare supplement plan, they have kind of discounts. It's not an actual dental plan. They say, hey, because we have this network of doctors, if you use our network of doctors, you'll get 10% discount or something like that. These dentists or something, right?
That's right.
Yeah. So I've seen some of those pop up some around, but remember, that's not a, dental insurance. It's just a kind of a discount type thing. So Nancy, another regular here. What's up, Nancy? Part of our 24help.org community that helps other people. I'm starting to get calls from the pharmacy department of my insurance company. I'm wanting to, what drugs I was not taking anymore, worried about money on their part. Know anything about, heard anything about something like that?
I have not.
So pharmacy department of insurance company, what drugs you're not taking anymore? I guess that might be good in some respects, that they're checking to make sure you're not taking something that you shouldn't be taking, possibly.
It could also be a way to like pivot you into maybe signing up for like mail order to get your prescriptions like mailed to you.
Oh, okay. So,
which is not a terrible thing. But
No. Yeah, some people love it. Some people like supporting their local pharmacy, going down, talking to their pharmacist and stuff like that. So remember, it's part of the 7 Ps when you sign up for checking out your Medicare Advantage plan. That's one of the things. If you really want to support a local pharmacy, make sure you have that name so you find a plan that covers that particular pharmacy. All right, let's see. We're already in a Medigap plan. You can switch to another Medigap plan any month. No need to wait for open enrollment. That is 100% correct. Yeah, if you have a Medigap plan, also called the Medicare Supplement Plan NGF, you can switch that any month. You don't have to wait for the annual enrollment period. But you depends on your state. You just might have to go through health underwriting. And have you done health underwriting before, Sarah? Help people with that?
I have.
So what kind of questions are we talking about nowadays? How long does what's the whole process? Do you have to bring them in there and have them cough and take blood work and all that kind of stuff?
Yeah, so what we do on our part is we, for one, we kind of have a preliminary process to really see if people can pass underwriting. But most of these questions, it's just on an application and we read it over the phone and they're just yes or no. So questions around like any treatments for cancers in the last 5 years. It also just depends on the insurance company, but we take a look at medications as well. Some insurance companies will like they'll auto decline you for certain medications as well. Like gabapentin is a really common one. That is a declinable drug. So we take a look at all of that.
But some they have a look back of a year, 5 years, 3 years, or something like that. So it really depends on the particular company in the particular area, and y'all kind of know which ones. If a kind of a flag pops up and it says, "Oh, okay, well, if that particular case, when was it?" Okay, so if it was within the last 3 years, then this company is not going to take it, but another company might, right?
That's right.
Okay. Linda, my brother's having major issues with prior authorization. So number one, Linda, thank you for taking care of people around you, particularly your brother. He has cancer, but he can't get authorized for a biopsy to determine whatever type of prostate cancer he has.
That's terrible.
Yeah, that's completely unsatisfactory. So how would she fight something like that? That seems like it's a no-brainer, because a Medicare Advantage, when you sign up for a Medicare Advantage, it's essentially you're kind of giving up Part A and Part B. You're giving up original Medicare, and people say, well, because I'm giving it up, I don't have to pay the $185 of Part B anymore. Well, unfortunately, no, you still have to keep Part A and Part B, but you're giving all of your health care, requests to whatever Medicare Advantage plan you sign up for. And they're supposed to cover everything original Medicare does. So if the person needs a biopsy in original Medicare, then doctor says you need a biopsy, then you get a biopsy, period, in the story. There is no second guessing. But with the Medicare Advantage plan, they do the prior authorization. So how can she fight something like that? Seems like a no-brainer.
Yeah, I would like to see if there was maybe a letter, because the carriers typically will send out a letter saying why they denied something. So like if we could take a really good look at that, sometimes it's missing a certain piece of information that the doctor needs to provide. It can be as simple as that. But there, of course, is an appeals process that 60-70% of people don't take advantage of. And the insurance companies know you don't take advantage of that. So
Exactly.
so that's what we're here for. So
Exactly. And all this, and it's going to get worse going forward, because, like Medicaid, you can't cut $1 trillion, close to $1 trillion out of Medicaid and not to have, hurt everybody else. The Affordable Care Act, 20 million people are going to be uninsured. Social Security, 7,000 plus employees, the most seasoned, the most experts have been vacated from the premises. So over the next several years, it's going to be far, far, far more difficult to deal with the bureaucracy. And that's why we've come up with our kind of network to help y'all, including all Linda and everybody else here that I know is going to join 24help.org and help out their neighbors. So, and she's already helping out her brother. So fight on that one. So, but a lot of people, so she has to have the letter actually denying it. And in the letter, it'll say why it was denied. That's
correct.
Okay. So Linda, did you get the letter, and did it say why it was denied? So a lot of times it is, that's the trick across the board. We're really going to see that on Medicaid, is they're going to deny people for the most insane things. you didn't check this box. You didn't date it with, the full 2026. You just put 26. You didn't sign in this third place that we needed a signature from. You didn't include this other form that we didn't tell you needed. That's the trick that a lot of these states are going to use, because they just don't have the budget to take care of, people on Medicaid. So they're going to try to, put as many roadblocks up. And that's going to happen across the board. And people are going to need more and more help going forward. So get the letter, find it. And yeah, doctors are technically supposed to help with this, but a lot of doctors, they're especially small doctors, small offices, they're just overwhelmed with these prior authorizations, right?
Sometimes they just don't address them either. Like, they have incredibly long processing times, and I would think as a doctor, like, your patient would be your priority. And like, you would do everything you can. But yes, they are also notified if anything is denied. And the little tip here, like, if you are going to appeal like a decision for a prior authorization, it's a really good thing to get your doctor to do that for you.
But at least get the documentation, find out exactly what you need. And
Exactly.
yeah, and you see this on social media. Doctors left and right are on social media saying, I'm just fed up, and they call and they get the prior authorizations, and I'm sure you've seen some of these, Sarah, where the doctors call in to get these prior authorizations, and they have to sit on the phone for an hour or 2 hours and talk to someone that's not even a specialist in this particular field, and trying to get authorizations. And some doctors are saying, you know what, I wanted to become a doctor to become a doctor to help people, not to deal with insurance and prior authorizations and all the nightmares. And you mentioned that 60% or so of people don't even fight these things?
That's right.
Yeah. But the good news is that of those who actually take action and fight whatever prior authorization or whatever the case may be, what type of success rate are we looking at?
Oh, if you appeal the first time, it's almost always approved after that first time, because they figure you're going to be so upset about like the determination that you're not going to read the second page for the appeals process. So.
Yep. There you go. So that's it. Fight across the board. Social Security, Medicare, SNAP, the Medicare Advantage, whatever the case may be. Medicare supplements, you don't have to fight. That's the great thing about those, right? If the doctor says you need it and it's medically necessary, yeah. So I'm waiting for the trials for hair loss. I heard UCLA came out with some male pattern baldness new revolutionary thing that that's only on testing right now. So I'm hoping maybe we'll talk later. We'll talk later, Sarah, and see if you can get me into that study.
Okay.
This time next year you'll come back and I'll look like anyway, got a full head of hair, hippie or something. I'll be another homestead hippie here. So Medicare Advantage is a pay-as-you-go insurance. My father had a quadruple bypass while he had Medicare A, B, D, and F. What would an operation like that cost if he had a Medicare Advantage? Well, we know how much. So he had a quadruple bypass surgery and he had Plan F. How much did I know you know how much it cost. How much did his quadruple bypass surgery cost with Medicare Supplement Plan F?
Whatever that premium is.
Yeah, the monthly premium. So after that, zero, right?
Exactly.
So he just paid for his monthly premium, $100 a month or whatever like that. And the $1 million or whatever it cost for the quadruple bypass, it cost zero because he had Plan F. If he had Plan G now, how much would it cost?
Be that premium plus the Part B deductible, which $257 this year.
$257. That's it. That's so people, that's why they get the Medicare supplements. But in terms of Medicare Advantage, it really depends on the Medicare Advantage plan at that particular time. They've got the MOOP, right? What are you seeing with what is a MOOP? And any trends out there across the country on those are increasing or decreasing, or what are we seeing?
Yeah, so the max out of pocket, this is just the most that you would pay in a given annual year if you had a bad health year. Ideally, you don't want to meet the max out of pocket ever. But yes, this is a trend every year. I believe the cap is 9,250 for the max out of pocket for Medicare Advantage plans for next year. I haven't seen too many changes. I'd say that's relatively the same. Like some plans have 9,250, some have 6,700, 4,000. And then depending on where you live, I've seen some of those be like Florida, California, 1,500, like very little.
Yeah, Florida always has the super lowest. I've seen like yeah, a few $100 or something, to $900 or something. Time Travel asks, if a person signs up for a Medicare Advantage and wants to switch to Medicare, well, they already have Part A and Part B because they have it. You can't get a Medicare Advantage if you don't have Part A and Part B. And if you have a Medicare Advantage, then you probably have a Part D, because for most Medicare Advantage plans, Part D is rolled in there, right?
That's right.
Okay. But if you have a Medicare Advantage plan and you want to switch to a Medigap plan, how difficult is it to switch?
It really just depends. There's a few different factors we would look into. When did you start Parts A and B? Because sometimes if you're still within your first 6 months of starting Medicare, like you can switch into a Medigap plan, no medical history questioning. If it's your first year on a Medicare Advantage plan, so like let's say you're 9 or 10 months in and you started off with a Medicare Advantage plan and you decide you want to go to Medigap, there is an opportunity. We call that a guaranteed issue for that. Otherwise, if you're not within those windows, you're going to have to go through medical history questioning. So it would just depend on like your health and what medications you're taking. And so it could be difficult or it might not be difficult. It just depends on where you're at in your Medicare journey.
All right, let's see here. I'm lucky I'm on QMB, and if my Advantage plan denies anything, I can just go back to straight Medicare. Well, yeah, you already have Medicare. Oh, okay. Yeah, the QMB, what QMB is Medicaid. That's the higher levels of Medicaid. The higher levels of Medicaid are QMB, Slim B, QI, and those are part of the Medicare Savings Program that the state is paying for your Part B premium, the $185 or whatever it's going to be next year. So a lot of people that have Medicare and Medicaid, they're dual eligible, Medicare and Medicaid. And if they're in the higher levels of Medicaid, they can get a dual eligible, Medicare Advantage dual eligible plan, which sometimes has some extra benefits depending on what's available in your particular area. One of the things that they have, or traditionally had until this year, is really, really generous, those OTC food cards. Depending on your area, still might be somewhat generous, but the program, was it called the VBID, goes away December 31st. And so a lot of those food cards are going away, or they're being reduced significantly. Are you seeing any trends there?
Yes, I've seen some of those benefits go down, but they are restricting that benefit access to people that have chronic conditions.
Yeah, so up until now, this is the big scammy. It wasn't a scam, but the way they were advertising, the way Medicare insurance brokers and agents out there, they would get on Facebook and say, "Are you eligible for $2,400 a month of free Medicare and gym membership and food and stuff like that?" And you click the button, and that's why you're getting all these calls now, is because you clicked the button 3 years ago. And yeah, they're going to harass you forever, unfortunately. But that was the kind of the scam. Those cards did exist. They did exist. But the problem is how they would do this. It was kind of a bait and switch type thing, where they would find the best card in the country in, Dallas, Texas or something, and advertise it to the rest of the country. You got $2,400 card. And then you call them up from Homestead, Florida, or Portland, Oregon, or wherever. And they said, "Oh, you don't live in Dallas? Well, sorry, you don't have it. But, we got your number down. We're going to try to sell you something else." But they did exist, and they existed because of this Medicare regulation called VBID. but that goes away December 31st. There is another program that Medicare has had longer, and it says Medicare Advantage plans can give those to people with chronic conditions. And I think it's also not only chronic conditions, but there's some other like 3 categories. They have to have a chronic condition, and the food card or over-the-counter card or whatever they're going to give people, they have to kind of prove that it's going to improve their situation, or they might be hospitalized if they don't have that or something. So there's some extra hoops that people have to jump through, right?
That's right.
Yeah. So because of that, a lot of people are losing those cards. Again, it really depends on your particular area. Really depends on your particular area. Very few people have reached out to us and said, actually, it's gone up a little bit in my area, or it stayed the same. But most people I've heard, it's gone down. Same with you as well.
Oh, yes. Yes.
Okay. All right. So time travel, yes. Switching from a Medicare supplement to an Advantage, it's almost 100% an individual type thing. What state you're living in, when did you sign up for Medicare, how long have you been on Medicare, how long? Yeah, so it's very, very difficult. The enrollment periods for Medicare Advantage, Medicare supplements are, it's like advanced algebra or something. It's very difficult. It really depends on your particular situation. So there are many podcasters promoting chapter this year. No wonder it's extra busy this year. Yeah, but we have the best community anyway. Let's see here. What's the average amount of insurances that get canceled every year? This year, we know it was like 1.1 million. And last year, I thought it was about 600,000. There is no real average. It really depends on, the companies. As Ari from chapter always says, these companies are in either one or two modes. They are in expansion or they're in margin mode. So the last few years, they were in expansion mode, trying to get as many members as possible. For 2026, they are in margin mode. They're trying to make as much profit off each individual as they possibly can. And that's, I think, going forward, they're going to be on that mode for a few years. And that's one of the reasons, you're definitely going to need help fighting. Question. My roomie wants me to enter a 2-year trial for a new biologic. Will a company generally allow that? What do you think?
Yeah, we touched base on that earlier with the clinical trials and Medicare coverage.
Okay. So it really depends. So Angela got in on chapter the first time. All right, good deal. So because y'all are open. I hope Sarah, you're not working all these hours, because chapter is open from 8 to 10 East Coast time, Monday through Friday, and then Saturday and Sunday from 9 to 9 East Coast time. Correct?
I believe so. That's something
Okay.
I have not memorized.
Okay. All right. So, and luckily, they're not making you work every single one of those hours every single day, right? You personally, at least.
No, I'm definitely on like the 11-hour day train though.
Okay. All right. Does Medicare Advantage pay for all dental services or just cleaning? Yeah, it really depends on the Medicare Advantage plan. So, all right. You see any other questions that we need to get to? I got a lot of Social Security questions, unfortunately. I'll get back to answering Social Security questions tomorrow. I'll come up with a topic tomorrow and then answer those. With the Medicare Advantage plans, even the price you pay every month, also, like we know, the big cities have a big advantage because they make more money in big cities. Is it true? Pretty much, right? That's why out in the desert, you've got like one company that offers one plan, and it's like take it or leave it, right?
Pretty much. Yeah, like there's some rural parts of Kansas where there's only like cost saving plans, and then parts of Washington that only have like $87 monthly premium plans. So, yeah, it does vary. If you are closer to a city, there are more like choices available to you that are like $0 plans.
Let's see here. Leo girl. Hello, I'm 69 and have been on regular Medicare Plan G. I was on Plan F, but heard it was going away. Just got my plan info with monthly payment amount, and there's a big hike after 6 months. Oh, yeah, Plan F. It's not going away. It's kind of gone away. New people can't sign up for Plan F unless you were eligible for Medicare before. Was it January 1st, 2020, right?
That's right.
So it's still there. But the problem is it depends on what category you bought it. That because it's no longer available, the people that are in that plan are getting older and getting sicker. So if your plan prices for Plan F are going up, they're probably going up substantially because the insurance is a pooled risk. So you were able to switch to a G. Monthly payment going up after 6 months. I know Medicare supplement plans, they usually come out with new pricing the beginning of the year, January, February, March, or something like that, right?
It depends on a person, it depends on the insurance company, and then it depends on how the plan is rated. So most of the time, people are going to get increases around their birthday month or their policy anniversary month. But United Healthcare is a bit of a special case here. They're the only company that does their increases June 1st of every year.
And then there's somebody sent a question in our comments yesterday about the cheapest plan in their particular area. It really depends on the state in terms of whether the cheapest plan is the best. Because again, for Plan G, a Plan G is a Plan G is a Plan G. So they're all exactly the same. It's only price. But be careful with the cheapest plan because one thing Chapter does when they look at that, they also look at the history of that particular company and say, okay, yeah, this is they're kind of a little bit of a lost leader here. They're trying to get you in, kind of trick you in with the cheapest plan in the area. But this company has a tendency to raise the rates the next year considerably. So, you've got those, Southeast Texas firefighters, Medicare supplement Plan G plan. It's a kind of a small company or, a small place. You just have to be careful. You don't want any surprises trying to get in on the low end because they know once you get into a Medicare supplement plan, after that, your initial opportunity to get a Medicare supplement plan, it's far more difficult to get out unless your health, you can pass health underwriting. So they kind of get you in there with the low one, but be careful, right?
Yes. Yeah. You want to be mindful of nothing against the smaller companies or anything, but we do see them tend to leave the market after like a few years. So
yeah. Oh, Homestead Hippie corrected me. Yes. I'm a she. It's 8 or 10 kids, 20 grandkids, and 10 great grandkids. Just found a new baby starting in a couple of months. Wow. Holy cow. Wow. Very busy. I just bought a dental plan for $159 a year. It covers a good chunk of all appointments. Awesome. Good deal.
solid.
Yeah, that's not too bad at all. About $15 a month. Let's see. Never got my money's worth with dental insurance. Front desk girl told me it wasn't worth it for sends me out TMJ. They claim that the condition should be paid by medical insurance. Yeah, that's what a lot of people don't understand is that original Medicare doesn't cover dental, except, as I always say, exceptions. If you have like a terrible traffic accident or something like that, you get your jaw messed up. Once they fix your jaw, they can do stuff dental wise as part of that, right?
Yeah. If it's like medically necessary, like
Right.
for whatever happened during that accident. Yeah.
So same thing on vision. Original Medicare doesn't cover vision, but if you get a corrective, if you get some type of eye surgery and you need some corrective lenses after that, then it's covered by original Medicare. So it's the exception. That's the problem with all this. It's the bureaucracy has gotten more and more difficult, and you really need someone to help you out there. So that's why we brought Sarah and Ari, and that's why I'm here every day. So that is it for today. I think we've got through most of the questions there. I sure appreciate you joining us, Sarah, and I don't want to take any more of your time because you probably got 400 calls to return.
We got a lot.
Yeah.
Messages, calls. Yeah.
Okay. All right. Hey, you take care of yourself, and everybody else, please take care of each other, and y'all have a great day. And if you got Social Security questions, remember, I will be back here tomorrow. I'll come up with the topic of the day, and then we'll spend the other 50 minutes answering your questions. So y'all take care. Thanks again, Sarah. You take care of yourself. Get some sleep.
You too.